Hey guys, welcome back to Medical Coding with Blue. Today's episode is all about the exam length times for medical coding credentials. Now, if you're brand new to my channel, welcome. I am so glad you're here. I am Blue. I'm a medical coder. I have been a medical coder for over 10 years, and I like to share the things that I know on my channel. I like to talk about medical coding, my experiences, and little tidbits about medical coding. So I hope if you're interested, you'll join me. Hit that subscribe button, hit the notification bell so you'll be the first one to know. And if this video has helped you at the end, I hope you'll share it. I hope you'll give it a good thumbs up, and let's get started. Okay, so there are many different medical coding credentials out there. And yes, while there are many different ones, they all have different exam length times, okay? So today I'm talking about the American Health Information Management Association credentials, as well as AAPC, the American Academy of Professional Coders. Now, if you're serious about being a medical coder, you need a credential through one of these two powerhouses, okay? This is what they're looking for when they're looking for brand new medical coders. So let's get started. All right. The first one I'm going to be talking about is Ahima, and I will be leaving the links to all of the associations down in the description box below, so that way you can check the website yourself, okay? If you are going to prepare yourself for the exam, you need to make sure that you know everything. View the candidate guides on the Ahima website, and make sure that you take a look at the AAPC website if you are sitting for their CPC credential exam. Okay, so let's get started with the first one. So the first one is the one that I like to call the gold standard of medical coding credentials, because this credential says that you can code both inpatient and outpatient coding, okay? This is a certified coding specialist. It is offered through the American Health Information Management Association. It is a 4-hour exam, and it has 97 questions that are multiple choice. 79 of these questions are scored and 18 are pre-test questions. Now, these pre-test questions are not counted against you whether you get them right or you get them wrong, and they're sprinkled throughout the exam, okay? So there's no telling where they are, okay? It's not going to be your first ones. It's going to be sprinkled throughout the whole exam. So that's just something to be aware of. And then you will have 8 scenarios with up to 3 separate questions on these scenarios. 6 of these scenarios will be scored and 2 will be pre-test, okay? Just so you know, okay? And the next one up is the Ccs-P, which is a Certified Coding Specialist Physician-based, okay? It is also 4 hours. It is also offered through the American Health Information Management Association. It has 97 questions that are multiple choice, with 79 of those that are scored and 18 that are pre-tests. And it also has 8 scenarios with up to 3 questions, and 6 of those scenarios are scored and 2 are pre-test, okay? And then you have the CCA, which is the Certified Coding Specialist, the Certified Coding Associate, and that is a 2-hour exam. It is 100 multiple choice questions with 90 that are scored and 10 that are pre-tested, okay? So again, it's going to be sprinkled throughout the exam, okay? And then we have the degree programs with Ahima. You have the RHIA, which is the Registered Health Information Administrator. That is your bachelor's degree. If you are sitting for that exam, it is a 4-hour exam. It consists of 180 multiple choice questions. 160 of those are scored and 20 are pre-test, okay? And then we have the RHIT, which is the Registered Health Information Technician. This is your associate's degree. If you are taking this exam, it is 3.5 hours. It has 150 multiple choice questions with 130 of those scored and 20 that are pre-tested. Okay, so that is all of the ones for Ahima that I'm going to address. They have other credentials that are specialized with Ahima, but these are the most common, okay, for medical coders. Like I said, there are specialty ones. If you're interested in finding out about those, please be sure to check the Ahima website, and I will leave it again down in the description box below. All right, so now we have the CPC, which is offered through the American Academy of Professional Coders. Now, this exam is a 5-hour and 40-minute exam, okay? It consists of 150 multiple choice questions. It assesses 17 areas of knowledge, and you must get a 70% to pass, okay? So that is all the information that I have about the exam links and the amount of questions that you will have on these exams. Now, I'm going to give a little bit of advice when you're taking your exams. Yes, there are some people that will break it down by the minutes and how many minutes. Is it a minute and a half or 2 minutes or whatever? And that's how they gauge to make sure that they are on track. Here's the thing. When you're taking your test, this is the biggest advice I can give you guys, is go with your first instinct. Because if you sit there and you get hung up on a question, which inevitably will happen because we are medical coders, and we do eventually start to overthink things, I implore you to not do that, okay? Go with your first instinct, because 9 times out of 10, you know, your first instinct is right? Okay, so you actually know more than you think you do, okay? The problem comes into play when we start to overthink, right? When we start to second guess ourselves. And that's not going to do anything for you except, number one, waste your time. And number two, make you feel insecure. And then all of a sudden, you're going to really start second guessing yourself. Put all of that aside and just go through the exam. And just make sure that you're reading everything carefully. Make sure that you have practiced before you go and take your exam. There are plenty of practice exam books. I've talked about the practice exam books that are available out there. You can go through the association websites. They have them there as well. You can also go on eBay or Amazon and look for practice exam books or practice scenario books that you can use. So that way you can work on your speed, okay? The thing is, you're going to have to work on your speed. Make sure that you are getting through really quickly. You need to make sure that it's not just about knowing your fundamental basics. It is about your speed. It is mostly about your speed. And the most complaints I've gotten from people when they talk to me after their exam is that they felt like they were just hung up. They would get hung up on something too long. And I'm telling you guys, it's not worth it. Just get through the questions. You know more than you think you do, okay? So just go with your first instinct and move on, okay? If you feel like you got one wrong, just keep going, because it's not worth it to miss all these other questions because you're trying to rush at the end, trying to hurry up, and then, you know, where you could have taken your time, but because you got hung up on one question, right? And how do you know it wasn't like a pretest question if you're with Ahima? So I'm just saying, but that is something to keep in mind. It is very important to be prepared when you go in, but don't over prepare, okay? Don't stress yourself out to the point where you are just so, like you crammed and everything like that. Don't cram, okay? Because that's the worst thing you can do for yourself, because all you're going to do is just freak yourself out when you go in for the exam. You are about to embark on the beginning of a wonderful journey, okay? And the way that you do that is you go in there and you walk in with confidence. And yes, it is something that you're learning. And sometimes you may learn it fast. Sometimes you may learn it for a long time. And then you go in to go take your exam. The point is that you are about to embark on this wonderful journey into medical coding. You just have to get past the certification exam, okay? And the reason that you're able to get past it is because you can walk through confidently, and you have that inside you that you know what you're doing. And it's very important to keep that, okay? Don't fake it till you make it, because you have it. You have it. You just have to make sure that you are applying it, right? You have to make sure that you are doing the things that you're supposed to do for yourself to prepare, okay? And if you've done everything you can to prepare, give yourself a break before you go and take your exam. I stopped studying right before a few days before I went to go take my exam, because at that point, like my mom said, you're not going to learn anything new within these next couple of days. Just take time off. Just take time off, relax, and then when you go in, you'll be refreshed and ready for your exam. And she was right. Of course, mothers are always right. But I'm just saying, so that way you can know it's not as scary as you might think. And there's been some people that say, well, Blue, I have extreme anxiety when it comes to taking exams. What is the thing that you should ask yourself is, what is so scary about this? I mean, it's paper. It's paper, but this paper determines your future, yes. But is it physically scary? No. Is it going to bite you? No. It's literally going to it's going to be the start of your future. You should embrace it, because when you embrace it and you go through and you work like you're supposed to, and you get all the scenarios done, and you don't stay hung up on things, and you're able to get through at a very good pace, and you finish your exam confidently, then you got it. Okay? And if worse comes to worse, take it again. You know, it's not the end of the world if you have to take it again. But I'm just saying that that's the worst that could possibly happen, is that you have to take it again. You know? So that's just something to consider when you are taking your exam. Yes, it is something that, like, none of us like to sit through tests. Who likes to sit through tests? But it's just a fact of life. And it is just part of the process, you know. But once you get out of this, the world is your oyster, okay? Then you'll be able to start applying for jobs, which will be another hurdle that you'll have to go through, unfortunately. Yes, it's true. And I've always been upfront about that. It is difficult to get a good job. It is difficult to get a job in the beginning. But once you get that first job, it is smooth sailing after that. It is not anything that is going to be a big deal after that, because then you can really start to know and develop as a medical coder. And I talk about coder development a lot on my channel. It's not just about knowing the codes. It's not just about knowing how to look things up. It's about your personality and how you're coming across to providers and communicating with providers, and it's in your professional presentation. That has a lot to do with it too. So just keep those things in mind. It is so much more to being a medical coder than just the looking up the diagnosis and things like that. You go above and beyond. Into the way to go above and beyond is to be the entire package as a medical coder. You got to have the personality, you got to have the brains, you got to have the drive, you got to have the energy. And the energy that you give off is going to be contagious. Okay, it's going to be contagious to the people that are around you, your other coworkers, as well as your providers. Okay, so you want to be somebody that's positive. You want to give off that positive energy, because positive energy begets more positive energy, instead of, well, you know, I just work in an office and, you know, oh, I hate it. And you don't want any of that. You want to be where you can't wait to get to work. That's where I am. And you know that expression, if you love what you do, you never work a day in your life. I love that expression. Do you know why? Because I feel like I'm there. When I spend all my time at work and then I come here and I talk about medical coding even more, and then I'm up. I will confess this. I'm up at 11, sometimes 12 o'clock at night, responding to emails and texts, as far as like just messages coming through from people that are asking about medical coding. I'm up, you know, and then I'm up really early in the morning because I have to be to work at 6. So I'm usually up right now because of the pandemic and, you know, we're at home. I mean, obviously I don't have to get up as early, but I'm still up by 5 o'clock in the morning, you know, and so that's, you know, I mean, it is a constant thing, but I've developed into this medical coder, and where I'm just constantly going, and it does drive me. I mean, and I do love it, and it grows all the time. So, you know, but that's what I think is amazing, is to have a career that you truly do love. And if you're at that cusp of that happening right now, because you're about to go and take your credential exam, whenever they do start letting people take their credential exams, it's going to be an amazing ride. I mean, honestly, it's going to be an amazing thing, and you're going to learn things, and you're going to be exposed to different kinds of people from all walks of life, whether it is your providers or your other coworkers or the nurses that you work around or the staff. It is really, really amazing, you know. And like I said, I've said this many times, I really don't know in my life where I would be if I wasn't a medical coder, you know. So, but yeah, that's my advice on that. And don't stress when it comes to that, because that stress will just get you. And stress is so unnecessary. It really is. And if you start to have those feelings like, oh, I'm feeling anxious, don't fall into that. Try to redirect your thoughts and redirect your mind. It's going to be all right. This test cannot physically attack me. It is not going to do any of those things. I am in control of this test. What the energy that I put into it is what's going to come out at the end. And if you have to study a little bit more, you have to study a little bit more. I mean, that's all there is to it. We are asked to learn and know things that doctors know that have gone to medical school. And the vast majority of us as medical coders has never been in medical school. I'm just saying. So to ask us to have this responsibility is pretty incredible when you think about it. And it's a lot. It's a lot to have that responsibility. But you have to want it. That's the same thing too. You have to want it. Okay? So that's just my advice on that one. But yeah, so I just thought I would go ahead and give out this this schedule type deal, and all of this information is available on the website. Okay, when you're studying, try to set yourself up in a mock exam. Okay, before you go in for your exam, maybe like a month out, start doing mock exams where you are blocking off that particular amount of time, and whether it's the 2 hours or the 3.5 hours or the 4 hours or the 5 hours and 40 minutes, try to set that block time aside with no cell phones, no distractions, and just try to do your test. Take a practice exam book for whatever credential you're sitting for, and just sort of, go through that way. Some people say, well, I don't have that much time to do that. Well, then break it down into, 1 hour sessions or 30-minute sessions, whatever you can do to break it down. But just know that however many questions you have to get in that amount of time, that you need to make sure that you're efficiently getting through those questions in that amount of time. Okay. But setting yourself up like that will sort of kind of calm those fears and calm that energy, because you'll already sort of know what it's like to be in that setting. Okay. You'll know what it's like to be in this for 4 hours, or for 5.5 hours, 5 hours and 40 minutes. I always want to say 5.5. Sorry, 5 hours, 40 minutes, or 2 hours or 3.5 hours, that kind of thing. So set yourself up for success and do those types of things. So that way you have that, and you'll have it behind you. And then by the time you know it, you'll be a credentialed medical coder and you'll be out conquering the world. So, but at least that is my hope for you guys. Okay. And that you continue to watch my channel because you've subscribed and you've hit that like button and you've hit that notification bell, and then you see all the episodes that I come out with. So I am already working on next week's schedule. I already have a couple of episodes already. Actually, I have 3 already, and I will be announcing those next Sunday, so that way, or on Sunday, so that way I can tell you guys what's up for the next week. So if you have any suggestions for episodes, I hope you'll send them to me. Contact me by medicalcodingwithbleu@gmail.com, or my Instagram at medicalcodingwithbleu, or on my Patreon. I do have a Patreon channel, and that Patreon channel is the minimum pledge is $1 per month. I do quizzes there. I talk about myself there, and it's like YouTube, but more on the brainy side as far as like the quizzes and things, and then I talk about just different things about myself. So yeah, minimum pledge is $1, and then I have some levels that have tutoring. So I offer one-on-one tutoring through my channel as well, and it is part of the package if you pledge a higher level. So if you're interested, I'll be leaving that link down in the description box below. Okay, so I will go ahead and wrap this one up. But if this has helped you, I hope you'll share it and give it, like I said, thumbs up. All right, I will talk to y'all in the next episode. So if you are a medical coder, a medical coding student, somebody curious about the fascinating world of medical coding, a provider or a nurse, I invite you to like and subscribe and follow me on my journey in medical coding. I will see y'all next time. Bye.